In this film, you'll learn step by step how to perform intermittent catheterization on a female user with the Luja catheter. It's important to avoid transferring bacteria from your hands to the catheter. So start by washing your hands thoroughly with soap and water and apply a pair of clean gloves. Spread the labia apart and clean the area around the urethral opening according to guidelines. Now prepare the catheter. Hold the catheter with the handle pointing upwards. Open the catheter by turning the handle in either direction to break the packaging. Gently pull the handle upwards, approximately 2 centimeters, until you feel some resistance. In this position, you can connect a urine bag. Pull the catheter out of the container. You are now ready to perform catheterization. Spread the labia apart to make the urethral opening visible. With your other hand, slowly and gently insert the catheter into the urethra. Continue to insert until the urine starts to flow, and then a bit further. When the urine begins to drip slowly, the catheterization is complete, and you can remove the catheter. You can dispose of the catheter as you would with normal household waste, but not down the toilet. The container is recyclable and can be disposed of according to local guidelines for recyclable waste. Wash your hands and you have completed the process. The Luja catheter is intended for single use only. Before use, always consult the instructions for use document delivered with the products.